Aloha. Prenatal. Ooh, my prenatal. I love being here in this prenatal time. So I'm gonna go through maybe about 3 or 4 exercises, and whenever you find in the prenatal, hi Julie, whenever you find in like any of the workouts that we're doing online, that we're going into something real core-y, like core focused in like an abdominal sit-up or an abdominal crunch, just learn from these kind of sessions to take these prenatal movements and replace it into your workout. So any side work you can do. Side plank, beautiful for your body. Side plank clam. Once bump starts growing, it gets heavier, right? So it's actually going to get harder. But continue pushing through that as long as you feel comfortable. Do not ignore any abnormal pain. If you feel something doesn't feel right, you know best. And if you're a first-time mom or you've had a baby before, you know, mama's instinct, we know, okay? So listen to that. Also going on to anything like anything on our front here, take it to an incline. You can still, if you're still wanting to do a burpee, you can still do a burpee. Take it here, bring it in, lift it up. In mountain climbers, have it on that incline, and I want you to always think, I'm gonna hug baby. I'm gonna hug baby here, and I'm gonna put it in. So if you think when you're hugging baby, you're shortening your abdominals, you're strengthening your core muscles. So in that, it's so different from the postnatal. So in the prenatal, you want to hug baby, breathe out, hold that abdominal hold around baby. No matter how early you are, that you are in your pregnancy, hold around baby, and then you can lift it in. It's a beautiful way to work the abdominals during prenatal training, and same on the floor here as well. If we were to lift it up in a side plank, any side positioning, any kick-ins we do here, you can do it as long as you feel comfortable doing it. Of course, you're going to be challenged, but just feel comfortable doing it. Another tip here as well in prenatal: do not get overheated. So if you can, whack a sports bra on and a pair of leggings, because we don't want you to get overheated. As well, coming down, roll and head onto your back. And once you start going into 2nd or 3rd trimester in upper body movements, for example, we're doing a chest press, maybe just pop 2 cushions behind you and then roll on top of those cushions. You'll see this in the prenatal highlight anyway, how I do it. And then you're gonna be on a little incline there. Abdominal work, just forget like any kind of crunches, bicycle, any movement like this, you just don't need to do it anymore, okay? So think of core work as is gonna be side plank hold, our superwomans, tapping it in. You can be here and down. Yeah, any kind of movements there. Push-ups. If your tummy starts going into this point out like this, incline. And that's postnatal as well. Incline thing. Well, not even postnatal, anybody. If you feel that your tummy is just pointing out, use an incline to help take that pressure away from your core. And then start lowering it down. But in prenatal, use this incline, please. It will massively help you. So yeah, for example, in push-ups, do them on the incline. Any jumping kind of movements, we're gonna crack on in a minute. Any jumping kind of movements, you can continue as long as you feel comfortable, but if you're not feeling comfortable, you don't have to jump to get a good workout, okay? So extend those arms a little more, reach a little wider. Again, hug baby a little more, use your abdominals. keep your glutes strong throughout your pregnancy training. And yeah, so if I think of any more, I'll let you know. But that roll here at the bottom, roll. Instead of coming up, roll. And that's for postnatal as well, especially post-birth. Stick to that roll. It will incredibly help your postnatal recovery. Okay, so let's head into onto all fours. I hope this helps, but this is episode 1, so hello. We're gonna go onto all fours. I want you to hug baby. It doesn't matter how many weeks you are. I want you to really start getting your brain to think about breathing out, hugging baby here. Exhale. So just keep hugging baby. Now in this position, if you want to work your pelvic floor, exhale, lift, hold, keep hugging baby here. Do not let go of your abdominals until I tell you to. So if you've got a nice big bump, you're gonna feel and you're gonna see your bump should really kind of get smaller. You can really hug around baby. Now exhale and release. Inhale, release. And just allow your tummy to be soft. Give your hips a little wiggle. Again, exhale. Push the floor away, hug baby. If you want to work pelvic floor, lift pelvic floor right now, 10 seconds. Keep hugging baby, feel your abdominals wrap around. 3, 2, 1. Exhale, release. Inhale, release. And then wiggle your hips. Exhale. Hug baby. One more time. Push the floor away. Very similar to postnatal. You're wrapping your abdominals here. Breathing out. Grab pelvic floor if you want to work pelvic floor. Actually, grab pelvic floor. You need to work pelvic floor. It's important. Pelvic floor contraction and relaxation. So being able to relax your pelvic floor. They both work very importantly. 3, 2, and 1. Shake it out here. From here, extend away, lengthen away. Grab your balance, slide along the floor, breathing out. Now, as your bump grows, this movement is going to get more challenging. So enjoy that. And sometimes you'll find baby will sit more on one side of your body, so one side's going to be easier than the other. Keep your balance here. Keep going, 8 seconds. 3, 2, 1. Drop that back arm. We're going to push into our glutes here because it's really important to keep your glutes activated throughout your pregnancy. And postpartum, you need to get those glutes awake straight away. That's why I always put the glute work in that postpartum series. Especially a glute bridge, beautiful place. Keep going, 8 and 7 and 6, 5, 4, 3, 2, exhale, release down, round your spine, tuck your pubic bone under, tuck your tailbone under, and feel that stretch, lengthening from the top of your spine to the bottom. And release there. Exhale, hug baby. Push the floor away. When you're ready, slide onto the other side, lengthen out. Keep your hips facing down. Focus on balance. Keep hugging baby. Grab pelvic floor for 8, 7, 6, 5, 4, 3, 2, 1. Drop that elbow down, push through your heel, go for your glutes here. Go for 8, 7, 6, 5, 4, 3, 2, 1. Release down. Shake it out here. Give your wrist a little shake. Come into a side plank. Lift it up here. Or if you want to hit it on your toes, you can. You will find in pregnancy, depends on where you are so capable. And especially when you get to like 22 weeks, you get this energy back from that first trimester, which is super mind-blowing and super hard on the body. So around 20 weeks, you will get your energy back. Hold it here. So knees or toes, depending where you are. 8, 7, 6, 5, 4, 3, 2, drop to your knee, like myself. Tiny pose for 8, 7, 6, 5, 4, 3, 2, 1. Shake it out. Heading into that other side. So as well, like I said, please incline, because you will feel like you can do everything. You can do everything, but just focus on what's good for baby as well, okay? But keep your fitness up. Any questions, ask me as well. I'm here. I've been through it. I know it. But keep as fit as you can, because it's important for you here and important for you in here. If you're on your toes, 10 seconds. Get ready, drop to your knee, tiny pulse up. Go for 8, 7, 6, 5, 4, 3, 2, and 1. Shake it out. Push yourself into that downward dog. Hug baby. Exhale, press up. Push your heels down. And slowly lower down. Exhale, hug baby first. Press up, push your heels down. This is going to be our last move, and then next week we will go on to, I won't give you that whole lecture in the beginning, but I hope it helped. And release down. Exhale, hug baby, extend. And release down. Exhale, lift. 3 more. And release. Hug baby first. Make that effort there. Exhale, lift. And release. Hug baby. Exhale, lift. And gently release down. Knees nice and wide. Push your bottom back and just enjoy this stretch here. Take your knees really wide so some bump can come through the center. Think of inhaling and inflating your tummy now. And when you exhale, I want your tummy to be soft. So you're going to inhale, inflate your tummy, and then exhale, relax your tummy there. Really big inhales as well. I actually used this technique for when Jax went into a bit of shock when they induced me. So I really focused on my breath and breathing into my belly and expanding my belly, and I literally like channeled my breath to him to calm him down while he was inside of my belly. So your breath work is incredibly important, and really use these kind of positions to focus on connection and breath, okay? And go for that last breath. And exhale. Shake it out there. Good stuff. When you're ready, lift yourself up. During these sessions, you'll find I'll start moving as if I am pregnant again. All right, big love, and let me know how you get on. I'm going to sign off prenatal now and come back on for a kick. But fire any questions at me that you are unsure of, because I'm here and I'm so passionate about this. So big love. I hope this helps.